Hello, my name is Doreen Gonahasa. I am a field epidemiologist with the Uganda National Institute of Public Health, and I coordinate the Intermediate Field Epidemiology Training Program, which I'm going to talk to you about today. First, let me start by telling you what Field Epidemiology Training Program is. So the Field Epidemiology Training Program, commonly abbreviated as FETP, is a competency-based training for public health staff that has been implemented in a number of countries globally. So since 2015, Uganda has been implementing the Field Epidemiology Training Program through the Public Health Fellowship Program, a 2-year in-service competency-based training program that equips health professionals with skills in public health emergency response at national level. In 2016, we launched the FETP Frontline, and in 2021, we launched the intermediate level FETP. Now let me tell you more specifically about FETP Intermediate. So as the name suggests, the tier falls between the advanced and frontline FETPs, and it primarily recruits public health staff at regional level. These would be individuals that work either at the regional referral hospitals or regional emergency operation centers, or at the duty stations served at regional level. As the first recipients of health data, these sites are critical partners in timely detection of public health emergencies. The Intermediate FETP program is a 9-month-long program and involves 5 modular workshop trainings interspersed with mentored worksite projects. The worksite projects directly apply what is learned in the classroom modules and are meant to address real-world issues that trainees face on their job. The projects emphasize health data utilization, timely outbreak detection and response, generation of evidence for public health interventions using data, and communicating these findings to relevant stakeholders for appropriate interventions. With the first 2 cohorts, the program has covered about 7 regional referral hospitals and 3 regional emergency operation centers, as well as trained staff from the Ministry of Health headquarters, with at least 3 trainees from each of these sites. The intermediate program is gaining recognition among both the Ministry of Health and regional emergency operation centers due to the practical nature of the training. Important to note, these trainings are critical in routine work improvement, including improved outbreak detection and timely response. While the program is still in its pioneer stages in Uganda, graduates and trainees from the Intermediate FETP have participated in both the recent COVID-19 pandemic and the Ebola outbreak that happened in Western Uganda, during which they supported contact tracing, active case search, and alert management, amongst other things. Now, the World Health Organization recommends that there be at least 1 epidemiologist per 200,000 population, which would put our target as a nation at about 220 epidemiologists. This program is our way of contributing towards filling this gap. FETPs fill an important gap by increasing the number of competent field epidemiologists who are not only trained, but also have practical experience in implementing their training in the field by the time they finish, because they do real-time studies and work. FETPs have proven success in growing the public health workforce capacity across all levels of the program. With the expansion of decentralization of health management in Uganda, it is becoming increasingly necessary to equip staff working at all administrative levels with the skills and competences to respond to public health emergencies in a timely manner, thereby limiting disease spread and working towards global health security. Now, while health staff undertake several trainings before and during their work, this training program stands out because of the manner in which it changes the status quo and has proved relevant for overall public health management. We applaud the Centers for Disease Control and Prevention for the foresight in developing this program, and the Uganda Ministry of Health for embracing and supporting it.